Hi, this is Ariana, and this is my infertility story. I first want to say I'm putting this out there because all the women that are going through this also, we feel like we're alone. And anytime I look up infertility stories, it's like the same five that I keep looking at and keep watching. And I just want to be another woman that would love to help anyone else going through this because it's probably the hardest or one of the hardest things I've ever went through. I first it first started back in February of 2018 where I had an ovarian torsion on my right side and which ended up in a surgery that removed my right ovary. When this happened, I was devastated, but my surgeon and my doctor, my OB, told me that I could still have children in the future. That's been my number one goal my entire life was to have children. And from that day forward, I didn't really think about it too much until a couple weeks later when I had this weird intuition, weird feeling I could not get out of my head that something wasn't right. When I spoke to my OB, I told her that could my hot flashes be a result of anything or irritability or I don't know, fatigue. And she's like, well, I told you before that could be a result of your anxiety because you're so young, you shouldn't really be getting hot flashes. And I really told her that I kind of want a second opinion from like a fertility specialist. So when I did see a fertility specialist, it was 2 weeks before July of 2018. And when I spoke to him, he was amazing. He was so down to earth. And but at first he told me I was crazy also. He was like, you're 20 years old. There's nothing wrong with you. And I then went to proceed in doing like an ultrasound and blood work. And he told me, he was like, you know what, the results will come back in about a week or so. So just let me know and just give me a call in about a week and I'll give you the results. So that's what I did. I waited a week and I still wasn't getting a call. So I called the doctor's office and got the results that my AMH, which is anti Mullerian hormone, which is also your ovarian reserve or how many eggs you have left in your ovary. That came back at 0.03. That, if no one really knows, is extremely abnormally low for someone my age. That low of AMH results in a 54-year-old woman going through menopause. He also checked my FSH, my follicle stimulating hormone, which detects exactly when you're going through menopause or kind of looks at it. And mine was 78.1. A normal 19, 20-year-old individual that gets that checked should be around 0 to 15. Anything above that kind of says you're going through menopause. From that day forward, I went into a Great Depression, like extremely low. I would not get out of bed. I cried 24/7. That was all in my mind. I couldn't think about anything else. And I was stuck. I didn't know where to go after that. Then I went to a therapist. I didn't believe in him at first, but my therapist was amazing. She actually listened. She stepped me through the whole process. She goes, what do you want to do? And I said, I want to have a child. She goes, okay, talk to your fertility doctor. So that's what I did. When I went to see him, I gave him a call, set up an appointment, and I said I want to do it. I went through a cycle of IVF medications and I went through a 9-day medication span. And unfortunately, that was no result, no response was taken from my ovaries. Like there was nothing going on. He couldn't find my ovary. He said he thinks it's abnormally small to the point where it's just non-visible. And the only way to look at it, instead of doing a surgery, then I then said, nope, there's still hope. And I do have some eggs left. I'm going to get a second opinion. So I went to get a second opinion at CNY Fertility, and they said, you know what? I think the medication you were on before wasn't strong enough. So we're going to put you on a little higher of a dose. We're going to put you on 300 gonal F and also put you on 75 IU of Menopur. And I have to do 2 injections a day for about 8 to 10 days. Then I have to do a trigger shot, which is the HCG shot, and then like other shots and stuff like that at the end of the cycle if you're about to do an egg retrieval. Mine didn't get that far. I then had ultrasounds throughout the week, throughout the 10 days, and on day 5, they finally found my ovary for the first time. They said usually by day 5, you can find some type of follicles, at least like the starting of the growth of some, and every follicle contains about 1 egg. Unfortunately, since they did not see that, they said, you know what, keep trying, don't stop, let's try for another couple days. Um, and then when day 8 came around, I came in for my routine ultrasound and blood work, and all my levels started dropping. Mind you, when I came to CNY, there was also a miracle that happened. And the miracle was that my FSH went from 78.1 to 19.59. That's unheard of. They said they are in complete awe, they don't understand it, but they're going to take it. We're not going to question it, whatever. And I told them I want to redo the blood work because I didn't believe it, and it still came back at 19.59. Then on day 8, when I went in for my ultrasound and blood work, all my levels started dropping. My estrogen was depleting. My FSH started going up again. It's just everything just started going downhill. And when I went in for the ultrasound, they said by day 8, if you don't have any follicles, you aren't doing an egg retrieval. There's no ovarian response at that point. And that was my luck. There was no follicles, no nothing. And I just sat there and screamed and cried. And I thought I could just hear the news one more time and just say, okay, I mean, got the news before. It's nothing I haven't heard before, but it was just like ripping off a band-aid. All the emotions just came right back. It's just like, it's one of the worst feelings you can ever have. I felt like, and I actually did. People, if you ever are told that you're going through infertility and people say you aren't going through a loss, like it's fine, you didn't lose a child, you did. You lost that opportunity. Don't ever have someone tell you it's it's not as bad as you think. You're not dying. Do not ever listen to that. It is one of the hardest things to ever endure. Um, and I didn't think I was going to go through it. I really didn't. But it's reality. I'm still not giving up. I still research IVG, which is actually in vitro gametogenesis, which I know it's coming out in like about 20 years, but I'm still looking to see if there's trials. It's basically, long story short, they take your skin cells and make a gamete, which is an egg. And they have done it successfully in a mouse and created 16 pups. And they're trying to do that now for humans. And I want to jump at that opportunity so badly. But I have to be patient. Since I am 20, I do have time. But with all of this, I have an amazing sister who is 18. She was also tested just to make sure she doesn't have what I have. And she is okay. And she is amazing enough to say that she can help me maybe in the future. I thankfully, with all of this happening and me going through this, I did have leftover medication that I paid over $6,000 for, or my parents actually helped me out. And I was able to help another woman trying to go through IVF who couldn't afford it. No one has just $6,000 just laying around. So for me to be able to help another woman try to have her own child was probably one of the best days of my life. And I'll never forget it. They're keeping me in touch. I'm going to see if the actual process works. And if it does, I am going to be ecstatic for them. But thank you for listening in and hearing me out and hearing my story. I really, really hope that this helps anyone watching this or anyone with a family member that is going through it. Please have some empathy. Please just don't just ditch them and say it's nothing. It takes a toll on yourself. A huge toll. And God bless everyone and hope your love multiplies.